No.
Hello everyone, my name is Kenneth Dalton, and I'd like to thank you for coming out today. Imagine if you woke up one morning and your child had an ear infection. You take them to the doctor and the doctor says there's nothing they can do because they have no medication that can help your child, and your child is probably going to die. For myself, this concept did not seem realistic. I believed that a simple prescription of antibiotics would clear up the entire situation. Like many of you here may believe, I think that a doctor should give a prescription for most, if not all, ailments. This belief changed when I last visited my doctor for a sinus infection, and she told me that she would not prescribe me medicine, and that time and rest was the only prescription that I really needed. She continued to explain that she did not feel it was necessary to prescribe a medication. I thought to myself, it's weird that a doctor doesn't feel that it's necessary to give me medication, so I began to do research. I found that a hospital survey conducted by the World Health Organization discovered that 25,000 people die each year in Europe from antibiotic-resistant bacteria. Today, I will speak to you briefly about antibiotic-resistant bacteria and how it affects mankind. There needs to be a higher awareness of antibiotic-resistant bacteria. Let us start by discussing what is antibiotic-resistant bacteria. Antibiotic-resistant bacteria is exactly as the name implies. It's bacteria that cannot be destroyed by your common antibiotic. Normally, bacteria reproduces through a process called mitosis. Mitosis is when it generates a mirror image of itself and continues to do this until it reaches a certain level. Antibiotic prevents this through a process called lysis. Lysis is what causes the cell to rupture by interfering with the process of mitosis. Bacteria evolves through a process called conjugation. This conjugation allows the bacteria to learn how to be resistant to some forms of bacteria or antibiotic. Conjugation is the passing of plasmids and RNA from a host cell to a secondary cell through the use of the sex pili. This sex pili transfers the information necessary for that bacteria to become resistant to antibiotics. Now this may raise the question, how could this happen? The process is trifold. Doctors are overprescribing, patients are misusing their prescriptions, and pharmaceutical companies are no longer researching antibiotics. A study by Dr. Haggerty and Associates determined that 88% of doctors will order a test or prescribe a medication if the patient so desires. Another doctor named Dr. Newman and his associates determined that 75% of low-risk physicians, which is your general practitioner that you would go to for everyday ailments, will be subjected to malpractice, and 100% of high risk will be subjected to malpractice. High risk includes neurosurgery, podiatry, and other specialized doctors. As far as the patient goes, misuse comes in the sense of if the doctor tells you that you will take a regimen of 2 pills a day for 7 days a week, and you only take a pill once a day for 3 days, then you're allowing the bacteria to learn how to resist this antibiotic, and it will pass this information on through conjugation to other bacteria. And the third issue for antibiotic-resistant bacteria is the reduction in number of prescribable antibiotics. The Infectious Disease Society of America found that in 2009, only 2 new antibiotics have been created. In 1990, over 20 major pharmaceutical companies were invested in the research and development of antibiotics. By 2009, this number had dropped to 2. As with any private business, the goal of a pharmaceutical company is to gain money. However, research is a very expensive process. The 2 new antibiotics that were created in 2009 required 75 strands to be submitted to the Food and Drug Administration, also known as the FDA, before it was approved for use by the common market. Compared to other non-antibiotic drugs, only 15 strands were required. Billions of dollars were lost in research, and it was found that it was not lucrative to research antibiotics. So you might ask, what is being done to remedy this situation? The Infectious Disease Society of America is leading the way. The IDSA is conducting studies to better understand this phenomenon. In October of 2011, information was collected from over 500 physicians that determined 63% of the patients they treated were infected by antibiotic-resistant bacteria. This forced those physicians to utilize a drug called colistin, a drug which was developed in the 1940s and found by the FDA to be dangerous for the kidneys in the 1950s. It was therefore removed from circulation. However, the doctors did not have any other means to treat the bacteria, so therefore they resorted to colistin. In response to this, a committee was formed on March 8, 2012 to address this issue. The IDSA, in collaboration with 50 other organizations, wrote a letter to the House of Representatives and the Senate addressing this issue. They encouraged programs such as the 10 by 20 initiative, 10 new antibiotics by the year 2020. They also encouraged the education of patients. Conclusively, antibiotic resistance is a real problem plaguing our society. In order to resolve this issue, it will take the support of physicians, government agencies, and you, the patient. In the great words of the Roman poet Ovid, an anthill increases by accumulation. Medicine is consumed by distribution. That which is feared lessens by association. This is the thing to understand. So ask yourself, do I really need medicine to get better? Or is knowledge the power that will cure all my ailments? Thank you for your time.